Okay, I have the top of the hour, so I think we're going to go ahead and get started. For the Delta program people, please remember to put your name, your title, and your organization in the chat. That just gives us a really good feel of who is all joining us for the webinar today. But yeah, thank you all for joining us today for today's webinar. We're here today to talk about quality. The event today, of course, is being recorded, and as always, the link for the recording will be posted on our website, and it'll also be sent out in an email following the completion of the webinar today. I think almost all of you that have signed in so far. Again, I'm Kate Stenyam, and I'm a program manager with the National Rural Health Resource Center. And the center is providing the webinar today through the Delta Region Community Health Systems Development Program. Your audio is muted by default, and that really helps to avoid background noise and feedback. We ask that you remain muted unless you have a question. To unmute your line, you can always just select the microphone icon in the lower left corner of your screen. If you're dialed in by phone, you just need to press *6 to unmute. You can also, of course, communicate through our lovely chat box, which is located in the bottom ribbon of the middle of your screen. So just one more reminder to put your name, your title, and your organization into that chat box before we get started. The National Rural Health Resource Center is a nonprofit organization, and we are dedicated to sustaining and improving healthcare in rural communities. The center is the technical assistance provider for the Delta Region Community Health Systems Development Program. The Delta Region Community Health Systems Development Program is funded by the Federal Office of Rural Health Policy, and that is in collaboration with the Delta Regional Authority. Here at the center, we are very committed to diversity, equity, inclusion, and anti-racism, and building a culture where difference is valued. And you can always learn more about our commitment by visiting our website or by reaching out to any of our staff. To get started today, I just wanted to run through some upcoming events. And so as you can see, you're all aware that we have our annual summit coming up. That is September 18th and 19th. That is a Wednesday and Thursday, and we're super excited to see everybody in New Orleans. So if you haven't registered yet, please go ahead and register. I do want to give a note that the hotel booking for Thursday night in particular is getting very, very full. So we definitely encourage you to get your registration and your coming up in this quality series. And so we've got another one coming up July 25th, August 30th, or July 30th and August 1st. So please come back and join us for all of the webinars in this series. So I'm going to introduce today's speakers, and while I'm doing that, I'm going to have Caleb, our lovely Caleb, launch our pre-polling questions. So please take out just a quick 30 seconds to a minute to fill out the polling questions, because it really helps us with our program evaluation. So if you could fill those out while I'm introducing Carla and Sarah. So Carla, welcome Carla. Carla is the Director of Program Management for Stratus Health and leads the organization's rural-focused programs. For more than 20 years, Carla has led a wide variety of national, state, and local initiatives, supporting rural hospitals and clinicians in improving quality and population health, such as implementing quality management methods, developing palliative care services, preventing readmissions, and transitioning to value-based care. She also is a certified professional healthcare quality expert. Sarah Brinkman is a senior program manager with Stratus Health and has dedicated her career to improving healthcare and well-being for individuals and communities. She's passionate about advancing health equity, including eliminating disparities in healthcare delivery and outcomes in rural areas. Sarah consults nationally on a wide variety of rural health improvement projects and also serves as the program director for the Superior Health Quality Improvement Organization. I'm going to turn it over to Carla and Sarah to get us started with the content today.
Excellent. Thanks so much, Kate. I just want to confirm, are folks seeing my screen? Okay, fantastic. Well, thank you all. Carla and I are excited to be with you today and over the next couple of weeks to dive into some quality related topics. We're going to spend today focused on the core elements of quality infrastructure. Just a little bit about Stratus Health, which is where Carla and I both work. Stratus Health is an independent nonprofit that works in kind of the intersection of research, policy, and practice in healthcare, leading collaboration and innovation to drive improvement in quality, safety, and equity. We really work at that cross section on a variety of different topics and with a variety of different types of service providers, but have a long history of working with rural providers and are excited to be able to be with you all for the next couple of weeks. So that's us again. You already saw us twice. Now you're seeing us on the screen too. That's probably enough. Before we dive into today's content, we just want to really call attention to your participation is key in this. So you've been asked numerous times to introduce yourself in the chat. That's fantastic. If you're able to update your name in Zoom to identify how you would like to be called. Sometimes when you log into Zoom, it says your facility name or something like that. It's nice for us to know who you are. You've already been asked and have participated in the first poll. We're going to give you some chat prompts throughout today's discussion. We'll have some opportunity for a large group discussion and debrief. We ask that you feel free to unmute and talk or raise your hand. Turn your camera on if you're able, particularly when we get to those discussion sections. We have content to share with you, but we are well aware that the knowledge is in the room, and we really are here to hold space for you all to be able to share with one another as well. So to get us started, this is a pretty safe question. Where again, you've already been asked to share your name, title, role, your organization. If you can let us know where you are, as Kate mentioned, she knows who you all are, but we don't necessarily know where you all are. We know you're in the Delta region. So if you can share your name, your title, role, your organization, and your state, and then just for fun, your favorite fruit or veggie. It's summertime, so fresh fruits and vegetables abound. Just an easy kind of icebreaker to get us started with the chat.
Is it anybody? Anybody can start?
Anybody can start. You can do it in chat, but if you want to weigh in, Kimberly, we'll let you chat. We'll let you chat out loud while other folks chat in writing.
Okay, my name is Kimberly. I am the marketing director. I'm at Allen Parish Community Healthcare. We're in Kinder, Louisiana. It's centrally located in the middle of the state. And I have Kelly Self here, who will be taking my place at the end of August. So she is the interim marketing director.
Great.
Hi, I'm Kelly.
All right, we've got folks weighing in the chat. Thanks for letting us know who you are and where you're from. Got folks liking blueberries, apples, tomatoes, watermelon, cucumber, cherries. Fantastic. Got favorite summer fruits. We've got favorite fall veggies, whatever folks are feeling. So this is super helpful for us to get a sense of where you're coming from. Ooh, Kimberly, lima beans. I don't know that I've ever had anyone answer that way before. All right, excellent. Thank you for participating in that. We appreciate it. This is the first in a 4-part series that we're going to be participating in with you all over the next couple of weeks, and we hope that you'll join us for the other sessions. The series is really centered on what we're going to be discussing today, which is the 9 core elements of quality infrastructure for supporting rural healthcare quality improvement efforts. And we'll give you a little bit of background today about where those 9 core elements came from and other resources that you can tap into to learn more about them. And then over the course of the next couple of weeks, we're going to dive into other topics as well, using those 9 core elements as our framework for discussion. So on Thursday of this week, we'll be focusing on patient experience. Next Tuesday, we'll be talking about patient safety. And next Thursday, we'll be talking about health equity. So you can see the timeline laid out there. We hope that you're able to join us for all 4 sessions. I know that they'll be recorded if you, for some reason, aren't able to make it. But if you find today to be engaging and informative, we're hopeful that you'll come back for the others as well. Carla, I'll turn it over to you.
Okay, so today, Sarah sort of outlined this already, but our objectives for today are to really identify those 9 core elements and then talk about how they connect to driving success and quality improvement. So today is sort of the big picture, and then over the coming sessions, we'll dive into each of them a little bit more deeply. So where we came up with these, if you want to go to the next slide, please, is the core element framework that we're going to be talking with you about was developed in 2003. We had the Stratus Health had the opportunity, along with our partners at the National Rural Health Resource Center and University of Minnesota component of the Flex monitoring team. They're the group that does a lot of the data and evaluation for critical access hospitals. Had the opportunity to pull together just a fantastic group of critical access hospital quality experts. So we had quality staff specifically from critical access hospitals. We had folks that work closely with critical access hospitals. We had a handful of critical access hospital CEOs. And I know not all of you are from critical access hospitals. That was the specific framing for this event. But I actually think the lessons that came out of it, the core elements, the criteria that we came up are really kind of broadly applicable when you think about quality in rural organizations. So to come together and how these elements and criteria were identified is that we had each of the subject matter experts do some pre-work. We asked them to look at a Baldrige framework, which is a kind of national framework for quality, and identify elements that they would prioritize in that framework. So we asked them to do that as a pre-survey, and we started the meeting with 200 elements or 200 variations of different elements before we even got started. Thanks to the fantastic facilitation from Deb Lane and Tracy Morton from the National Rural Health Resource Center, we were able to take that information and over 2 half-day conversations kind of lump and clump and combine and talk through and identify and get this down to sort of 9 core elements that the folks in the room thought were particularly valuable when you're looking at critical access hospitals, but also kind of more broadly thinking about what it looks like to have a strong quality program in a rural healthcare organization. Some of the core things that weren't actually elements, but I think were really important to the discussion that I want to highlight for you is that the group agreed that quality is more than measures. So I think a lot of times when we think quality, people jump straight to those measures that get reported or that you're kind of looking at from a clinical perspective, but that a quality program needs to be much more than those measures. They also recognize that quality can often be siloed, even in small organizations, and that for this really to be effective, quality needs to be part of everyone's role. And for people to have it to be part of everyone's role, we have to streamline and simplify how we're implementing our quality programs. And I did see the comment in the chat. I think we do jump straight to measures because oftentimes, more and more now, there's money attached to those measures. But how are we going to make those changes is really important. That underlying infrastructure is where we really tried to dig into here. So what we ended up with out of that report is actually 9 elements of quality infrastructure, and then there's criteria identified under each of those. So you'll be seeing these 9 elements over the whole series, but wanted to give you sort of this big picture of what's included in them. So we have a focus on leadership and responsibility and accountability, integrating equity into our practices, thinking about how we engage patient partners in the community, how we think about strategic planning and how quality fits into that component. We actually had 2 different areas. Culture and organizational culture was such a big part of the discussion that we actually split that into 2 different areas. There's a culture of improvement through behavior and a culture of improvement through systems. In order to get there, we have to have workforce engagement and ownership. And then because it's quality, we do have to have meaningful and accurate data, and then we have to use that data to be able to improve quality. So this is the biggest picture of where we're going to be kind of heading over the next, today and the full series. So I'm going to walk through the first few of these elements, and then I'll turn it over to Sarah to talk through the rest. The first, and I think purposely first, is the leadership, responsibility, and accountability. So I think I've been doing quality in rural for a long time, and people always want to know what the secret sauce is. And honestly, the secret sauce is typically leadership. So how do we have governance and administrative leadership actively demonstrating and supporting improvement for quality? So it could be that the board is engaging, or it does need to be that if your board or your leadership teams needs to be engaging and supporting quality. You need to be thinking about organizational resources, that they're adequately allocated. If you want everybody to be supporting quality, that needs to be incorporated into job descriptions, and it needs to have resources behind it for that to happen. And ideally, we'll have executive leadership who's overseeing the design and functionality of that program. So some of the examples for how you make this a little bit more tangible might be thinking about, if you look at your board agendas, if you have a governing board, is quality actually on the agenda? Is it a standing agenda item? Does it regularly get discussed? Is there a quality subcommittee? Is there a board member that serves on the hospital's quality committee? Or if you're in an FQHC, same thing. Is there somebody who actually serves on your committee that you're really getting that board level, governance level input around leadership responsibility and accountability? The next element is also closely tied to that leadership piece, but it's really about having quality as an intentional component of your strategic plan. So if you think about your organization's mission, vision, overall goals, where you're headed, how is quality sort of integrated into that? Are your quality leaders participating in the strategic planning? Is it a core element across the strategic plan, and how is it reflected in that? So some examples here might be that quality is actually kind of a pillar if you use a pillar structure for that, or that you have it connected to other areas. So is it clearly tied to finance? There was a comment about kind of, we focus on the measures because the payers focus about measures. That needs to be connected up through kind of the strategic plan. One of my favorite examples that came out of this was actually from one of our CEO participants, and she highlighted that they actually, the way they have this integrated into, for example, service line discussions, if they're looking at potential expansion into a different service line that they think will meet needs in their community, part of the conversation is, can we offer that service at the same or better quality than bigger facilities? And if not, that's a stopping point. If yes, then they keep the conversations happening. So that's one example of ways that you kind of build quality into those strategic discussions. The next area is workforce engagement and ownership. And this might be one of my favorites. I think another of my favorite quotes that came out of the conversation with our leaders at this summit was, do you rent your job or do you own it? Sort of like a house. If you have a leaky window or a squeaky door and you rent it, are you likely to fix it? Versus if it's yours and you own it, you're much more likely to take that time and intention to improvement. So how do you organizations have formal onboarding, thinking about how that fits even with right from the get-go, even into hiring? There was conversation about that. How do you kind of focus on quality as a priority? That there's regular opportunities for professional development related to quality. So that's kind of, again, becomes part of standard work and part of the conversation that you have as an organization. And then how diversity, equity, and inclusion gets built into those discussions and as part of that component. Other things that we look for in kind of this area is thinking about whether or not quality gets built into kind of rounding practices. Are there recognition of high quality performers or celebrations of wins, of things that are going well across the organization? And how often is there sort of feedback related to quality captured and gathered by leaders? Next area is the first of two that is focusing on culture. So culture really is sort of the kind of underpinning. I think you've all probably heard the comment that culture eats strategy for lunch. It's the unwritten rules of how work gets done. And it was the group felt it was important to highlight culture in two different aspects. So we first called out kind of this area of systems. So we have to have the underlying systems and processes in place that are designed and managed in a way that supports continuous improvement. So is there a standardized method for improving processes? If we want quality to be everybody's job and we want them to have ownership, we have to have sort of a common process method language for people to have those conversations about how we think about improvements and how we incorporate that into our daily work. It's incorporating expectations into job descriptions, department and committee charters, and it's thinking about processes for continuous reporting and monitoring of data. So thinking about whether or not you have a standardized process. Do you use a model for improvement, plan, do, study, act? Do you use lean? Do you think about tools like root cause analysis, or are you doing different kind of quality tools that help get embedded into your systems? So all of our processes kind of are in that system-based thinking's lens, kind of all connected. And how are we kind of underpinning all of those systems with the opportunities and aspects that help us support quality improvement? The other culture of continuous improvement component that got called out in this pair of elements is really around how do we think about behaviors? So we have our systems component and all of our processes happen within systems, but how do we set up our staff so that they're kind of have the systems processes in place that will support behaviors for them to be successful. So how do we strengthen QI? By having an adaptable organization that embraces innovation, motivation, and accountability. So again, this goes back to some of do we have that written into jobs descriptions, some of those system-based things, but are we actually monitoring and hearing practices? Are we following up on evidence-based protocols and order sets? Are we thinking about how we're demonstrating initiative to achieve goals and how we're rewarding that? Are we intentionally developing strong peer relationships? The participation in the Delta program is an amazing opportunity for you to tap into external partners, other peers, and learn from them across the board about how you can be improving. And then how are you thinking about kind of your infrastructure in terms of performance measurement, performance review? So our managers and leaders regularly evaluating behaviors to help ensure that they align with organizational values. So if you think about some examples about what this might look like from a really tangible perspective, if you asked all of the staff in your organization, could they verbally kind of share with you or describe at least one active improvement project or priority in the organization? That would be an example of kind of a tangible demonstration of what this might look like. Same thing with quality measures. Can they explain at least one quality measure or where you might find that information? Is that public kind of across the board? And can they identify who is sort of responsible and what's the commitment to quality across the organization? So if you ask your staff these things, would they give the answers that you expect in terms of commitment and understanding regarding what quality looks like in your organization? All right, Sarah, I'm going to turn to you.
Yeah. So this next one is integrating equity into quality practices. And you heard me say at the beginning that our fourth session of this series is actually going to be spent doing a deeper dive into the topic of health equity, including definitions and connections with other health-related concepts like population health, the value equation, the triple aim, eliminating health disparities. We all know that health outcomes for rural residents are worse than for those that live in urban and suburban areas. But this core element really calls attention to the disparities that exist not only due to geography, but within communities that have a shared geography. So how is the organization undertaking intentional improvement activities to ensure that everyone in the community has a fair and just opportunity to be as healthy as possible? And some of the criteria that the group identified is collecting and utilizing data. So you're going to find as we talk through these criteria that they overlap and intermesh. These are not clearly siloed 9 elements. You can't do equity and quality in practice without having the meaningful data. You also can't do it without having engagement of patients, partners, and community. So you're going to find some overlap as we go through these things today and over the coming sessions. How are leaders assessing quality interventions and processes to identify and to address those identified inequities? So as you're using data to identify what are the inequities and the disparities and outcomes, are leaders routinely assessing those interventions and processes that you are implementing? And do units and departments have specific health equity projects to improve care and lessen inequities? So one of the quotes, a few of these have quotes on them, as Carla's already shared, is that rural relevant needs to be more than measures. It's also about systems. How do we teach quality from the ground up? And when we think about those systems in terms of equity, what does it mean for incorporating that concept into everything we do, that there is no quality without equity? So some concrete examples would be things like stratifying your different quality metrics. So we've already had in the chat, the comment about quality measures and the quality measures that you report for different programs, not just reporting and collecting that data, but then looking at that data at a more granular level to identify opportunities for improvement. So maybe you're performing really well on something at the high level, but when you dig into it and you disaggregate that data, you identify that there are certain populations or communities that are being missed. Do you have an established process for accessing and analyzing externally sourced population or inequity related data? So you have your data that you're collecting. What about other data sources? Are you looking at other data sources that tell you about the community and the population that either is or has the potential to be served by your organization? As we start to dig in and talk about data, we're going to talk about the transparency of data and how you're sharing data and being accountable for data. And that is definitely has a tie directly to this concept of integrating equity into your quality practices. Are you regularly seeking and receiving patient and community feedback about perceptions of equity as it relates to how you're providing healthcare, and so on and so forth? So these are examples of really kind of tangible ways that you can be thinking about building and integrating equity into your quality practices. Directly related to that is engagement of patients, partners, and community. So what this core element does is really calls on hospitals to do more than, or healthcare providers to do more than the traditional patient family advisory council or patient experience surveys, and really move towards more active collaboration with community members and partner organizations, with the thought that if you focus solely on the patients that you're serving, which is who make up your PFAC and your patient experience survey, then you're missing the opportunity to understand why others in your service area maybe aren't coming to you for their care needs. So we need to be thinking beyond solely the patient population. They are an integral part of this, but also thinking broader to the community. So that element is defined as intentionally building external relationships with patients, partners, and the community to enhance access and improve the care experience. So that access piece is really important when we think about who is seeking and who isn't seeking services from the organization. Some of the criteria are that you're collecting feedback from patients and families beyond just those patient experience surveys. So that can take a lot of different forms. That can be in the form of town halls, going to where community members gather, doing other sorts of activities outside the walls of the facility, that you collaborate with other care providers, and using closed loop referral processes to help ensure quality of care. So this concept of closed loop referral processes extends from services that an individual might need in terms of specialty care, but also into addressing health-related social needs referrals as we're getting in more into standardized health-related social needs and social drivers of health assessment. What does it look like to work with maybe non-traditional partners in that sense? So you may have strong working relationships with your closest tertiary center or other specialty clinic providers, but do you have working relationships and closed loop referral processes with the service organizations in your community or at the region or state level that are helping folks with transportation or food or housing and so on? Do you have a variety of ways to share quality data with patients, families, and the community? Again, getting to that transparency piece, which is both, I think when we talk about accountability, sometimes accountability gets a bit of a bad rap, and it's thought to be like holding someone accountable so that they don't make a mistake, which is important. But it's also holding folks accountable because you want to celebrate the wins. This is a way to build support for your organization, which is integral to the community that you are in by virtue of the fact that you are serving a rural community, right? Your hospital, your FQHC is essential to the fabric of that community. And so sharing your data is not just in a way to hold you accountable because of potentially not fantastic outcomes, but also for great outcomes, to be able to share with the community the work that you're doing and help them understand the importance of that work. And then are your leaders synthesizing and developing action plans to respond to patient, family, and community feedback? So some concrete examples would be that staff engage patients and families in your bedside shift reports. That's a way to engage patients right there at the bedside. Do you have leaders who round on your patients on a daily basis? Do you have focus groups on at least an annual basis? So again, thinking outside of who are the folks who are seeking services in your facility and to the broader community. Do you have a PFAC, and is that PFAC actually functioning, right? So you might have a PFAC. Are they meeting at least quarterly? In what ways are you meaningfully engaging them in the work that you're doing? And then how are you continuously integrating feedback and lessons learned from engaging with patients and families? And here you can see how that then ties to what Carla was talking about earlier about leadership. So if you have a PFAC, is there someone from your board that routinely participates in that PFAC meeting? Or how is the board engaged in reviewing and assessing and helping to determine what happens with the feedback that you do get from patients in the community? The last couple that we're going to talk about are around data, which data is absolutely a cornerstone of quality. We need accurate data to understand how we're performing, where our opportunities lie, how our services may be perpetuating healthcare disparities and poor outcomes. So it's really essential that we have that we're collecting meaningful and accurate data using a multidisciplinary approach to identify what those key quality metrics are, whether they're required to be reported or not. So to the comment earlier, there are key quality metrics that you are tracking on that you're not reporting anywhere if you're doing this well. And prioritizing complete and accurate data collection. So we need to have a real comprehensive picture of what's happening in our facilities and our communities. So do you have a multidisciplinary process for identifying what those key quality metrics are, or is it more of kind of a top-down approach? Are you only tracking on key quality metrics because they're required for payment? Or are you identifying key quality metrics based on a multidisciplinary process where you're gathering feedback from multiple players in the system and in the facility? Leaders are identifying risks and opportunities based on analysis of those key performance metrics. Are you able to leverage your health information technology to support complete and accurate data collection? We know the pain that comes along with adoption and transition of electronic health records, but the intent of those electronic health records and the other health information technology that we now have access to is that it should facilitate collecting meaningful and accurate data. And then as we move into the next core element, using that data to drive improvement in a meaningful way. And then importantly, and this relates to some of the health equity discussion that we've had already, is collecting and documenting race, ethnicity, and language, also sometimes known as REL or real data, sexual orientation and gender identity, sometimes called SOGI data, and that health-related social needs data. And having a standard way for how you do that it isn't an assumption, that it's patient-identified, self-identified data that's being collected, that it's being collected standardly for all patients. That allows you then to do that disaggregation and identify where disparities might exist that you can focus on improving. And finally, is using that data to drive quality improvement. So using internal and external data comprehensively, meaningfully, and transparently to inform your quality improvement work. So does your organization share that data internally and externally? If I work there, do I know how to access what our quality scores are? And if I'm a patient there or a community member there, do I have a way of being able to access what our performance is on different quality metrics? Do you incorporate, again, that external data sources to inform your QI efforts? So not relying solely on the data that you're collecting, but also data that is collected at a population health or public health level to understand what your opportunities are at the community, that you're acting on and clearly communicating the data results from quality initiatives, that your leaders are involved in helping to push that forward, and that you use benchmarking to identify where you can improve. So quote here is that we need to use storytelling when we're connecting the dots from process to outcome data. left without being seen, for example, always has a relevant backstory. So as you're thinking about it, the emergency department, if you're at a hospital, when you think about what happens when a patient shows up at the facility and then leaves without having been seen in the ED, there's a backstory there. There's something that's happening. Someone came to the emergency department for a reason. We can use the data to help us then turn that into a story so that we're not relying solely on numbers, but we can translate those numbers into something that's compelling for our staff and our board and our community to understand when we're working on different initiatives. So some tangible examples would be that your quality initiative results, are they communicated to hospital staff? How are you doing that? Is it a newsletter? Is it a bulletin? Is it a poster? How are you sharing the outcomes of initiatives that you have underway? Are your initiative results integrated into future planning on at least an annual basis? This again goes back to one of the previous items, which is that strategic planning concept. So how are you taking what you've learned from quality initiatives and using that to help inform what you're doing into the future? Do you have a dashboard that you're sharing either with staff or the board or publicly that shows how you're doing with quality? We know that Care Compare, for example, exists at a national level for all hospitals to be compared, but how are you meaningfully taking action to share the data at a local and at an organizational level? Are you sharing anything on your website or on social media, etc.? So before we go into a kind of group and activity where we want to get some feedback from you, we want to pause and see if there's any questions about any of the content that we have covered so far. And I'm just going to quickly transition back to this slide, which has the 9 core elements to see, is there anything here that you were surprised to see, anything that you think is missing, any one of these that the definition or the examples didn't quite jive or you would like to discuss further? Okay, we'll have additional opportunities to continue this discussion. What we would like you all to do is take a couple minutes. I know some of you are gathered as a group, some of you are maybe on as an individual. What we want you to do is to let's take 2 to 3 minutes to kind of reflect on what core elements are areas of comfort for you in your organization. Where are you really knocking it out of the park? It comes naturally, it's kind of built into the way you do your work. And what core elements are areas of opportunity for growth? So take a minute on your own to reflect on that, or if you're with a group, to discuss amongst yourselves, kind of which ones do you feel really good about and which ones do you feel like these are growth edges for us? And I will bring us back together in a couple of minutes to continue the activity. Okay, so if you've not participated in a waterfall chat before, this is kind of a fun way when you're doing a virtual exercise to gather people's thoughts. So we're gonna give you 3 different prompts and then 3 different occasions. What we're gonna ask you to do is draft your response in the chat, and then I'll give you about 30 seconds to get your response drafted, and then we'll hit enter so that everyone's responses come in at once. And you won't be influenced by what other folks are saying, but you can see how everyone responds kind of in real time. So the first question is reflective of what we just asked you to do. Can you, in the chat, without pressing enter yet, draft your response to the question, what core elements are areas of comfort for you and your organization? And as we do that, I am again going to bring up the core elements so that you can see them here. So again, the question is, what core elements are areas of comfort for you or your organization? And I'll give you just 10 more seconds to draft your response. And you can go ahead and hit enter. So we have workplace engagement, managing quality according to data and collecting meaningful data, leadership, responsibility, and accountability, engagement of patients, partners, and community, using data to improve quality, engagement of patients, partners, and community, using the data, engaging patients, leadership, responsibility, and accountability. It's a great mix. This is what we were saying before, where the
We knew
knowledge.
the expertise is in the room. Yes.
Absolutely, absolutely. Embedding quality embedded within your organizational strategic plan at all levels, med staff and board. Excellent. Culture of continuous improvement through systems. Fantastic. Okay, so our second prompt here is, so you can start to draft your response, don't hit enter yet. What core elements are areas of opportunity for growth for you or your organization? And again, you can draft your response. I'll give you about a minute to do that. About 10 more seconds. Thanks, Michelle. Okay, folks can go ahead and hit enter. So accountability, culture of continuous improvement through behavior, workforce engagement and ownership, engaging communities, patients, culture through behavior, equity and strategic plan, leadership, responsibility and accountability, workforce engagement, so for almost all of these, someone identified it as a strength and others identified it as an opportunity, which is exactly what we would expect to see because different organizations have different strengths. This is great. Thank you. So we have one more prompt here, which is but before we do that, I want to open it up and see if anyone has any comments that they'd like to share or questions that they'd like to pose to each other in terms of what your strengths and your areas of opportunity are. And when you identified your strengths, what made you identify that as a strength? Why do you feel confident that that's something that your organization is good at? How does it show up in your daily work? Just ask folks to be brave and come off mute if they're willing, or you can weigh in the chat if you'd like. So for the items that you identified as, or the areas you found to be a strength for your organization, how did you achieve that? What does it look like? And I might call on folks. So I see we had someone who identified workforce engagement as an opportunity for growth. And I see Kelly Harris that you said it was workplace engagement was a strength. Would you be willing to share what workplace engagement looks like at your facility?
Yeah, it took me just a second to get off mute, but we have actually developed some team type. So we created this engagement opportunity where we divided everyone who works at the hospital into 4 teams, similar to the Houses of Hogwarts. So they're interdepartmental teams. We didn't want to work against each other's departments, but so it's an engagement where they can meet people, work together, and then we incorporate, we did our patient safety week and we had activities geared towards earning points for their houses. So that's really brought people together for the common good, not against other departments.
That's excellent. Thank you for that example. I love that. My 10-year-old would love it even more. That's great. How about an organization that identified a strength as being engagement of patients, partners, and community? Curious to hear what that looks like. There were a few that identified that as an opportunity. Looks like Javone Howard, Jamie Harvey, Kelly Self.
This is Jamie. I was gonna just say with Mainline, we do a lot of community involvement. We have a lot of school-based programs, and so we are a presence at their open houses, things like that. So we do a lot of community involvement. If the community has a, like a festival or something like that, we'll try to have a booth out there marketing, and I just feel like we do a really good job with that.
Awesome. Yeah, that's that idea of going to where people already are, right? So patient family advisory councils are bringing people to where you are, and then there's the opportunity to go out to where the people are already gathering. That's fantastic. Thank you. Others that identified engagement of patients, partners, and community as being a strength.
Can you hear me?
Yeah.
I'm sorry, my microphone has been acting up a lot here lately, but we really try to engage in everything that our community holds. We have been involved in with school activities. We have been involved in the annual activities the annual festivities that our organization here in Cairo holds, which is the Cairo Heritage Foundation. We are involved with our NAACP. We do events with our local college. We do events with it's just a lot of different partners that I can't really think of off the top of my head, but we really try to get out in our community and show support to everyone that we can.
Fantastic. Thank you. That's great. What about folks who identify some of the core elements or areas that you identified as opportunity for growth? What are your trouble points with those items? What's kind of the obstacles that you're facing around those? Is anyone who weighed in chat willing to share what you're struggling with more specifically than the broader topic?
Well, I was just gonna say, I just hit that link of the quality time that you just shared. And I think that's actually, to me, it's hard to make quality fun sometimes. And so that is actually, I think, very helpful. So thank you for sharing that, because I think a lot of times we get caught up in the data and the numbers, and just like the original person said, we jump to it because that's what payers care about. And we kind of lose sight of what we're actually doing the quality metrics for, and that's to provide the best service for our patients. So we get it becomes really mundane, and we get kind of overwhelmed by it, and we feel like it takes away from our actual purpose. And so if we can make it fun and kind of create that balance, I think that's where most places are probably missing the mark, if I was guessing.
And I think not of all of us, like I'm going to freely admit that I am not one that can come up with fun ideas. It's not the way my brain works. So if you have somebody who is on your team that if you give them a little direction, might be able to interested and willing to run with it, it's really an opportunity to kind of spread that kind of support around. So if you've got a natural party and engagement planner, get them on your side, have them help you plan activities. Because I would have never come up with some of the activities that our team shared on that podcast, that the folks that we talked to. Met another hospital that was like, they were doing a dunk tank when they met their sepsis goals. I mean, I just would not, my brain doesn't work that way, but I'm sure somebody at your organization, if not you, their brain works that way. So tap into them and have them help you plan for fun.
Absolutely. And when you think about how much time we spend at work, and then you also think about the fact that you're serving rural communities, and your staff are part of that community. And so the better that they feel about the place that they work and the work that they do, they're going to be ambassadors for you in the community and be able to really, you know, spread your message, your marketing, your, you know, and improve quality outcomes along the way. So that's fantastic. I want to do one more waterfall prompt, which is, we would love to hear from you. If you could share one thing that resonated with you from today's presentation or the discussion that we just had, we would be really grateful to hear from you as to what are you walking away with today, in terms of these core elements, the opportunities that you have, what you've heard from peers, what you want to dig into more. So again, I'll just give you about 20 seconds here to kind of craft a response. And then we'll do one final waterfall chat submission. Okay, you can go ahead and hit enter whenever you're ready. Yes, Kimberly, almost everyone is experiencing challenges, and often the same challenges. Not only using in-house data, but also that of the community. Fantastic. I'm glad that that was a takeaway. That's great. Carla did share in the chat, and there is a link also in the slides to the report that came out of the summit where these core elements and the related criteria were identified. And there are additional concrete examples of what was discussed. If you're wanting to dig into some more of those ideas around what does this actually look like, not just in a theoretical concept, but actually in practice. So I encourage you to check that out. And then we really hope that we will see you on Thursday. The next 3 sessions are focused on the topics that are laid out here with the framework of these core elements. So there are 9 core elements. There are 3 sessions remaining. In each session, we're going to do a dive into the topic at hand and then explore what it looks like to apply 3 of the core elements of quality to that topic. What does it mean in patient experience to be thinking about leadership engagement, for example, and so on and so forth. So we hope to see you on Thursday for patient experience. And then next week, again, Tuesday and Thursday, we'll be talking about patient safety and health equity. There is a poll up, your post-polling question, a repeat of the questions you were asked at the beginning. If you could take time to answer those 2 things, that would be great. And here's some contact information for Carla and I if you have any questions or want to get in touch with us in the meantime. Otherwise, I think I'm handing things back to Kate.
Yeah, thanks, Sarah. I think you got it all wrapped up there. Again, just a reminder for this Thursday's webinar and then next week as well, the Tuesday and Thursday webinar. So please join us. I just want to give a plug to Carla and Sarah, so wonderful. And here's their contact information. So if something comes up, you know, the topics that are coming up for the next webinars, and you would maybe like to have them dig in or touch specifically on something, please let them know so that they can tailor anything and make sure that they cover what your needs are or something that you'd want to learn more about on that specific topic as well. They both have a wealth of experience, and so are able to talk to about anything that I'm sure that you might have questions about or would want more information on. So with that, yeah, make sure you fill out that post polling quick so that we can get that information back from everybody. And that will close it out. Everybody have a really wonderful rest of your Tuesday, and hopefully we will see all of you back here on Thursday.
Thanks, everyone.
Thank you.
Thank you.